A lot of people think that actually the surgical part of the anaesthetic is the most risky part, but actually a lot of problems occur in recovery. Unfortunately, we don't have X-ray goggles or a crystal ball to say it's going to go this way or they may not turn the corner. Again, I think it also comes down to communication beforehand. I tend to go through so quality of life-wise, where are we sitting? I can, guide them in the direction to making that decision. I think if it were my pet, I'd be considering that they don't have a great quality of life.
When a vet says the word surgery, most pet owners don't hear a procedure. They hear risk, they hear anaesthesia, they hear cost. They imagine the worst case scenarios. But surgery in veterinary medicine is not casual. It is not rushed, and it is not something we recommend lightly. Today I'm joined by Dr. Emma Brown from Hillcrest Veterinary Hospital, a returning guest and someone who is deeply passionate about clear, honest communication with pet owners. In this episode, we're going to unpack what actually happens when surgery is recommended, from planned procedures to emergencies, what owners are asked to do before the day, and what really happens in theatre, what recovery truly requires, and what the difference is between a planned procedure and an emergency case at 2 a.m. If surgery has ever made you feel anxious, this conversation is designed to replace fear with understanding. Dr. Emma Brown, welcome back.
Cara, nice to see you.
We were discussing, obviously, off air, the kind of thing we're going to go through today, but for context for the listeners, we have had some of the discussion around surgical cases and what to do in the event of, but we've never really covered the whole process, the journey that vets take and our thought processes and owners take when it comes to surgical procedures, both elective, and by that we mean planned procedures,
yep,
and then those emergency cases, which you are obviously very familiar with because
yes,
working emergency work, we know that those can be a lot more emotive,
yep,
a lot more expensive, but we're going to tackle all of that today. So I suppose my first question, opening question for you is, what do you generally find the response is when you start bringing up surgery within your consults with your owners?
So obviously we go from pretty simple procedures that require surgery, so small lump removals, short procedures, to more advanced things like spays, neuters, and I think the thing that the owners find most daunting is actually the general anaesthetics. The fact that their dogs are going to be under for quite a while, that is generally what causes quite a bit of stress. And I find that that is their main hesitation in terms of wanting to go ahead with surgery or not.
So what is the kind of process you take them through? You obviously, most of the time, we've done stuff before. You've done a clinical exam. They're either there to see you for a normal consultation, a vaccination. They're not well. Like you say, I've noticed this lump. You brought up the lump.
Yep.
You've done a clinical examination. Are these some of the things that you discuss with them in order to manage their response?
Yes, so clinical examination is obviously to assess how well the patient will do under anaesthetic and to pick up sort of any comorbidities that could increase the risk of an anaesthetic. So we like to check their hearts, make sure they don't have any murmurs. Heart murmurs need to be investigated before we go into surgery. Check their lungs, make sure there's no breathing problems, and that they're otherwise healthy. Then, say for instance, we're doing a lump removal, we'll discuss the pros and cons of removing the lump and not removing the lump. We also go into details about sending the lumps away for like histopathology, if there's any additional testing that will need to be done after surgery, or if there's any revisional surgeries that need to be done after a primary surgery. So what is the whole journey looking like? How many days are we looking at? And then once we've got that, we obviously have to chat about costs as well, and give them an estimate of where this is going to fall and if this will fall in their budget. And then also depending on a budget, what extent are we going to go to in terms of, surgery? Are we just taking the lump off and not sending for histopathology, or are we, doing the whole thing? And then it also can, be further diagnostic tests in terms of blood tests for pets over 5 years old generally, just to make sure that liver and kidney function is okay before an anaesthetic.
And how frequently do you find that owners are keen to take up that additional process?
I think most of our owners are pretty pretty welcome to us suggesting further testing. We obviously want the best outcome in terms of anesthetic. So by explaining that if we do a heart scan before the anesthetic because we've picked up a heart murmur, they're less likely to have further complications. And we are also treating a comorbidity that is not going to then progress. If we see, for instance, they have kidney issues, we can adjust our anesthetic protocols as well. So in terms of what sedatives we use for pre-medication, and what things to be careful of. Do we need to put them on a drip for 24 hours before surgery if they do have kidney problems? I think generally they're pretty open to accepting additional treatments as well.
Why is it that, for example, when we have a client that phones in and they say, let's use a dental procedure, I'd like to book my cat or dog in for a dental procedure. If they haven't been seen in the last 6 months, we are very clear about the fact that they need to come in for a consultation?
So dental is actually one of the most difficult things to give an estimate on, just because obviously we can see the dental disease below the gum line, but we can't actually see what's going on in the bone and at the tooth root. So we often say, we want to check the heart. It's generally teeth are in older patients as well. So there are other comorbidities. We need to check again for heart murmurs, bloods, check the teeth, sort of give them a rough estimate of, what we're going to be doing. Are we just scaling and polishing the teeth? Does it look like there's some problem teeth with full mouth extractions, or just a couple of teeth that need removing? We're also able to get an accurate weight on the patient. We're able to discuss any existing comorbidities that they might have or any current medication that they're on. And I think picking up comorbidities is probably one of the most important things we need to find out, because that generally is one of the things that really increases our anesthetic risk. And it just helps the procedure go a whole lot smoother if we know what we're going into.
And are there any things that you pick up during a clinical examination that you say, well, other than heart, you've made mention of heart, but anything else that you say, if this is elective, we need to delay doing this procedure?
So for older pets, some have, sort of chronic bronchitis issues. Brachycephalic dogs, the short-nosed breeds, they often also have breathing problems as well. So making sure that, they haven't got things like collapsing tracheas or any sort of lung problems as well. Then obviously animals with any sort of like diabetes problems, how are we managing their anesthetics? Kidney patients, as I said, they need fluid resuscitation even before they go into surgery because of the impact that lowering the blood pressure of an anesthetic has on the kidneys. Also patients with liver problems, because our liver metabolizes all of our anesthetic drugs and sedatives. So if our liver is not functioning properly, we could run into some really unexpected drug reactions as well. Any sort of medication reactions, if they've had them in the past, that's also really good to know. So those would sort of be my things that I'd be looking out for. If they have a fever as well, that could indicate some, sort of inflammation going on. Do we have any underlying tick-borne viruses that we haven't picked up, or any other, infections happening that might prompt further blood work as well?
Okay. And what happens if we get, and I know that this is a sensitive thing, so I'm going to try and put it in the right way, when we have obese patients that come in and we're concerned, is that a reason to delay the anesthetic?
Yes, so obviously our obese patients do carry slightly higher risk as well. Cardiovascularly as well, they can become a bit compromised, especially if they're lying on their backs for a long period of time. They do battle to ventilate. It also allows us to see if the animals have a fever. Often this would indicate either some sort of inflammation, an underlying infection, and often our tick-borne parasites as well, often if they're early stages, can just show with a fever. So it's important to rule that out first.
And are there any breeds where we would be checking if they've got a bleeding tendency? Are those things that you pick up or that you advise on? Yes.
So one of the breeds that we do worry sometimes about these greyhounds, deerhounds, mainly your Sighthounds. Italian greyhounds as well. Those can be breeds that can be predisposed to bleeding disorders, and with underlying tick parasite infections as well. The tick parasites attack the platelets in the red blood cells, so they become anemic, and then obviously low platelet counts, which will affect clotting times as well. And that is a big no-no if we are doing a surgery, even to just remove a mass. Our blood's not going to clot, and we could run into serious trouble.
Let's talk about the patients that are either under or over ideal weight and how you manage that conversation.
So for our skinnier patients, especially for our really muscular breeds, again, like our greyhounds, they are prone to obviously feeling very cold during surgery. So we have things like bear huggers that we put on them, and that helps to keep them nice and toasty. Our temperature actually plays a huge role as well in our metabolism of our anesthetic drugs as well. So any cold animal is not going to breathe very well. They're not going to breathe in our inhalant gas very well. And obviously metabolism is not going to be great. So we expect longer recovery times as well. Then in our sort of obese patients, we worry about positioning when they are under anesthetic, especially for breathing, especially if they're lying on their backs or their sides. Extra weight is going to really struggle with ventilating. Obviously, your cardiovascular system has to work harder in obese patients as well. Because of the fat stores, they can metabolize drugs differently as well. So you can get like a secondary effect if you're doing like an intramuscular sedation. That takes longer, but they can also have a later period of sedation again, because the sedation is stored in the fat and then can move into circulation again.
You look at me, I look at you, I see the love in your eyes.
Health you can see, love you can feel. UltraPet, the science of love.
So owners obviously go home with a lot of advice, a lot of information. How frequently are you finding that they just feel overloaded? Are there situations where either the wife has got to pass the information on to the husband, or the person who's not actually the owner is coming into your consult room, and then they've got to relay this information? Do you often find that there's sort of miscommunication about some of this stuff, and you have to re-explain it or issue any verbal
and I think
or written stuff?
Especially for owners where there's quite a lot going on. So if there's investigations before surgery, after surgery, during surgery, it can get quite difficult. So what I like to do is have the consult with them, explain the procedure, and then send them home with a discharge note that has what we've discussed, the cost estimates, why we're doing the following. So I'll say bloods are recommended because we need to check liver and kidneys, or a heart exam is recommended because we need to make sure that they would be stable enough under an anesthetic. And then also just the pros and cons about the surgery. And then if it's a particular condition, for example, cats that have really bad stomatitis and inflammation of the gums and the mouth that need full mouth extractions, we have some really nice fact sheets that we can send the owners home to read in their own time and then sort of process that. And then if they have any additional questions, I normally just say, look, if you need to, phone in and we can answer any questions before you go through a surgery.
That has made a real difference, hasn't it, in terms of allowing that space to kind of process, as you say.
And then, we often give owners the full estimate for obviously our gold standard treatment. And then when they come in on the morning, we do have a checklist that goes through with them. Are you wanting bloods, histopath, vaccines, what are we expected to do? And it sort of gives them that space to go home and read about it and why they should do it, but then also come in and sort of choose how they want to tailor it to their budget, but they're informed about the risks associated with not doing those things as well.
So we're going to take some time to talk about sort of the admission process and what happens behind the scenes in a minute. But there are some things that you advise owners have to do, and I know that we repeat a lot of this communication when we book the appointment. We also send them information sheets to, again, just manage expectations. But what are the kind of things that you are telling owners to do, say, the night before versus the morning of a procedure if it's elective?
So generally the night before, they're starved from about 10 o'clock. They're allowed to have some water. This is to make sure that the stomach is empty at the time of inducing them for an anesthetic. This is because our drugs that we use to pre-med them or knock them out can make them nauseous, and we don't want them to vomit during surgery because they can then aspirate that. So in terms, swallow the vomit, which can go into the lungs. That can give us a really nasty pneumonia as well. And we also don't want that food content sitting in the stomach while the gut is not moving along, because our anesthetics have an effect on gut motility, and that can also make them feel quite unwell as well. Then, so they'll be starved from 10 p.m. the night before. Then we also look at things like current medication that they're on. So for instance, I keep going back to it, but heart patients need to make sure that they still get their heart medication in the morning before the surgery, so that they have got, enough cardiac support. If they're diabetic patients, that can be monitored a little bit more differently. So any chronic medication, whether to administer it or not administer it. And then they will come in starved and be handed on over to us in terms of then getting them ready for surgery. And
are you advising very young patients? I'm just trying to imagine a situation where we might do, let's say, a laceration in a very young puppy, or like a bite wound.
Yes.
Or I'm trying to think maybe the removal of deciduous teeth, that you're advising anything different in terms of feeding?
Yeah, so we often have a problem, or not really a problem, but needs to be kept in mind with our very small breeds, like our Yorkies, Beware Terriers, things like that, young puppies that are being fed 3 times a day. They obviously have a faster metabolism and are at risk of becoming hypoglycemic, so low blood sugars. So we'd probably delay, maybe not an 8-hour fasting, because that would really compromise them under surgery. So we would probably advise feeding still a little bit, then getting them in, starving them a little bit while they're here, waiting for them to, and then doing the procedure a little bit later on during the day.
And obviously slightly closer monitoring, which we'll talk about in a minute. So in terms of water, often we get the owners phoning in saying, okay, the vet advised no food, but can they drink? It's really hot. We've had really particularly hot weather recently. I'm worried about them dehydrating. Are you able to leave water down, or is that something you advise against?
Yeah, so we do leave water down throughout the night, and then when they come in here, the water is taken away. We obviously don't want to, have any fluid deficits before going into surgery, and if the patients do drink a little bit before, it's not the end of the world.
Okay, so they've arrived. Often we get the receptions to handle deposits. They need to sign a consent form. Let's talk about the consent form, what it includes, why people have to do it, because they often go like, I don't know why I need to be doing this. Yes. And it's such an important part for us.
So the consent form is basically to ensure that they are informed on the decision that they are making in terms of allowing us to assess their animal, administer sedation, put them under anaesthetic, and do the procedure that we need to do. But it does also outline there that obviously, to the best of our ability, we have given them, the options of bloods and things like that to rule out any complications. But in any situation, complications can arise, and we do our best to prevent them, but something could go wrong. It also gives them an idea of the cost they're looking at in terms of, how much it's going to be, what other procedures we're allowed to do. So are we also doing vaccines, things like that. And it's basically just to make sure that we have communicated everything to the owners have communicated everything to us, and we have a formal document in writing to show that they have been informed of what we are doing.
And we've had situations where it hasn't been the owner. So, it's so important, obviously, particularly for the receptionist, to ensure that the person signing it is the actual owner, that they are consenting, because there's a difference between consent and informed consent and consent by the right person, right?
Yes. So oftentimes if we have a situation like that, we would often make, as long as it's not an emergency, make sure we've got all the relevant paperwork from the actual owner. If someone else is bringing it in, we will have had that discussion with them beforehand, and we have email and things, so we're able to email those forms to them beforehand, get them signed, and make sure that they are done before we go in.
The other thing that I know we've got right now, but we used to have issues with, was being able to contact owners. For example, if you go in, let's say an elective surgery, not so elective, if you say you're concerned about a mass and you're going in there, and then you need to contact them and say, what would you like us to do? We have, things have changed generally through the surgery. Not having the correct contact number has been an issue.
Yes, so that's also really important, making sure we have the correct contact number. We also make sure we take an alternative number as well, just to make sure that if we can't get hold of the first person, we're able to get hold of the second person. And I also generally like to give owners a sort of rough guideline of, okay, well, we'll be in surgery for about an hour. We're starting at this time. You can expect a phone call around this time, but please make sure you do have your phone on you in case we need to get hold of you. This happens for dental extractions as well, because you'll get in there and then you're like, oh, we've got to take out 10 teeth. So we've got a phone to check that we can, take out those 10 teeth, give a rough estimate, and then go from there.
So a lot happens obviously behind the scenes that I think this is probably a really important part for owners to be aware of. Their pet gets taken through and a lot happens. So can we discuss the whole admission process? They've signed the thing, they've gone off to work. We generally give a point of contact, whether it be a receptionist, so that they, and like you say, they are kept informed and expectations are managed. But their beloved pet is then admitted generally into a kennel looking very sorry for themselves. Yes. What happens in the time from admission to before the procedure?
So they will then be taken out of the cage and we do our pre-anaesthetic check, which is a full check of heart, temperature, lungs, gum color. We weigh them as well to make sure we've got an accurate weight for their pre-medication. And then we will sort of chat about the anaesthetic plan. So say, for instance, it's a young, fit, healthy dog. We have certain anaesthetic protocols for those ones and pre-medications. So they'll probably get a pre-med injected straight away, and then they will be sent back to the cage in order for that to kick in. The older dogs will generally have a different cocktail, just because we have to be a little bit more careful with them. And then once that's all done, they will go back to their cage and await their surgery time.
And this is more than just the vet, isn't it? So who have you got as part of your team during this?
I've got my animal handler who's really holding my pet correctly for me if I need to place a catheter while I look at the heart, doing temperature as well. I also have my nurse with me who is listening to our concerns about this patient, what we need to make sure we do, whether that is making sure it stays nice and warm, making sure what parameters we're going to be monitoring during our anaesthetic as well, because our nurse is going to be there to assist us. Is there anything we need to be careful of? And then we will administer our medication and then go off. And sometimes as well, if it's a particularly difficult case, we might have multiple vets looking at the pet at the same time. They might be going off to have a scan, then coming back, then going off to have an x-ray. So it is quite a team effort in the morning to get everyone prepped and ready. And then while we're doing this, we've got some other assistants who are busy setting up our theatre, we go and check our anaesthetic machines to make sure they're working, and make sure we've got all our monitors set up for our theatre.
So let's talk about that. So the next sort of part of the process is the knockdown. I don't know whether there's induction phase.
Yes.
That's probably a better way of putting it. What happens during this?
So during our induction phase, we will have our nurse who will induce them, and that will be giving them an injection with, we call it propofol, which will make them go to sleep. She will place a tube into the airway with a cuff on to prevent any sort of thing in the mouth from going down the wrong pipe, especially if they do vomit a little bit. And then she will be attaching them up to the anaesthetic machine. Then they will be shaved and prepped and cleaned in the area where, surgery is to take place. And then while they are doing this, the vet is busy scrubbing up and getting ready to go into theatre. Then once the area has been prepped and the animal has also been stable, so again, we'll be monitoring things like heart rate, mucous membrane color, oxygen saturation, so how well they are, being able to take up the oxygen that they're breathing in from the anesthetic machine. Also, the depth of the anesthetic, are they too deep? Are they still a little bit awake? Where are we with that? How are we responding? And then the patient will then be moved into theatre for our final skin prep and clean, and all the monitors are then put on. So we'll move into the next part.
Yes, absolutely. So, this is now I think what owners would visualize is, the big lights, the sterile area,
yes,
the vet with gloves and gown, hat, surgical hat. This is generally a dedicated area that, unless it's a very dirty procedure or like a minor procedure area,
yes,
patients that are undergoing particularly abdominal or, joint surgery or that kind of thing will be moved into.
Yes.
We don't do anything else in there but surgery, is that right?
Yes, so like our dog bite wounds and sort of dirty lacerations can be done sort of outside theatre, just because they carry such a high bacterial load. They're normally done in the prep area, but again, still with the same monitoring, clean instruments, things like that. There is still a level of aseptic technique or sterility to it. And then anything, we have 2 theatres here. We're very lucky. We have abdominal theatre for like our general spays, castrations, and sort of any dirtier things. And then we have a really nice orthopedic theatre as well, which is where we have to do any of our very sterile orthopedic surgeries, so any bone fractures and things like that those we would do in there.
So when owners are like seeing the beep beep beeps, what are the monitors doing?
So we have a really nice monitor that monitors our ECG. So that's our heart rhythm and rate. That also gives us an indication of whether we're getting any abnormal rhythms. Could it be medication induced? Is it the patient waking up with the heart rate going faster? Is the heart rate going too low? Are they too deep? Then it monitors breathing rate, so how many breaths they're taking. This is also important for monitoring if they are too deep or too light. Also, if they're cold, then they don't breathe as well as that. We have an esophageal thermometer. So that means it's a thermometer that goes into the airways and down into the esophagus. So it's able to accurately take the temperature of the dog. And we also have pulse oximetry, which again measures your oxygen saturation, which is really important so that we know they're getting in enough oxygen as well. The other monitors that we use would be to look at the level of inhalant gas or anesthetic gas that they're getting, and we will adjust that depending on their depth. And then also oxygen flow. So how much oxygen are they getting? Is the oxygen in the machine adequate? Do we need to change cylinders? So there's quite a lot going on. So we will have a nurse monitoring our anesthetic. It's also quite comforting as a vet to hear the beep, beep, beep the whole time to know that everything's going okay. And there'll be an anesthetic chart where we record all of this throughout the surgery. And these parameters are taken every 10 minutes.
And you are obviously gowned and gloved up.
Yes.
So you need someone to be able to, if you make a decision, you want to use a particular suture material, because often we don't know at the time what we...
Yes.
A planned procedures, the spays, the neuters, I think most of the assistants and nurses can anticipate what that vet needs, the size of their gloves and things. You get very familiar with and
as per individual as well, everyone has their sort of preference on blade size, suture material, and things like that. So,
but otherwise, you can say, I need this. I would like, some more of this. I would like suture material that's,
Yeah. So generally, we have our list of things. consumables in theatre that we can ask for. We will also have a crash cart on standby, which is important, that will have charts with dosages of like your adrenaline and stuff already calculated in case we have an emergency. And our team also knows in terms of when we have to go into CPR, who's doing heart compressions, who's administering drugs, and who's calling the shots on what we're doing. So those are things we also think about before as well.
That's excellent. Okay, so we don't need to go into necessarily the technical stuff here, but the procedure is now done and completed. And I often, when we're seeing patients recover, see them, covered up and, or under a bear hugger, being monitored. Tell us the post-op protocol.
So a lot of people, I just wanted to say that a lot of people think that actually the surgical part of the anesthetic is the most risky part, but actually a lot of problems occur in recovery. And this is where we have to be particularly careful, because we need to monitor temperatures, make sure our breathing tubes are taken out at the right time. For dogs that have a normally elongated nose, they can have the tubes taken out earlier. Our brachycephalic, so our short-nosed dogs, have to wait till like the last minute to take those tubes out because of their airway complications. So we have a designated person that will sit with them while they are awake. They'll have the bear hugger on them. They will have their temperature checked. They will have the cuff of the ET tube taken down, and it will just sort of be in the mouth, but not fully inflated. And then as soon as that swallowing reflex comes back, the tube is taken out, and they sit in the prep area for all of us to see. So as you're walking around and doing your other bits and pieces, you can watch the dog recover and make sure that they are doing okay. It does normally take them a little while to come round. And the other thing that we have seen is, they do come around with a bit of a fright. And so we do have to sometimes have some sedation again on standby, just in case they have a little bit of a bumpy recovery. Mm.
And you can't anticipate that necessarily.
No, it comes out of the blue. 1 minute they're sleeping, the next minute they're flying around the room. So yeah, it's
why monitoring is so important.
Yes.
So we have an ICU room. I mean, it sounds super serious because, anybody associates ICU with sort of critical care type stuff. But most of our post-op cases, especially if they're high risk, if they're the brachycephalics or they're slightly young or they've got comorbidities, end up in ICU. Talk about what happens there in terms of when they're sort of awake enough to be able to be confined, but you still want visibility.
Yeah, so when they're in ICU, it just gives us the ICU, our ICU areas right next to where the vets are normally doing their notes, doing things on the computer, the main hub of the prep room, so that every time you're walking past, you've got your eyes on the animal, you can see what they're doing. And it's just to make sure that, if they start to suddenly look a little bit dull, if there's, for say, any bleeding that you can notice, say you've done a big laceration, they've now woken up and there's, blood spraying everywhere. It's also quick access. So they're right there near the prep room to get them out and assist them again if they are in trouble.
And why would that happen, for example? What changes when they recover that they might start bleeding?
So blood pressure goes up. So if you have, missed a small little bleeder in there, and as soon as the blood pressure goes up, they then start to bleed. So that would be something you can then quickly take them out. We'll have, again, the crash cart on standby so we can knock them out and go in and, fix that as well.
And many of them just a little bit of pressure, hey? So
or apply a bandage or something like that just to make sure that the bleeding stops. Mm.
So what is the time frame generally? I mean, we have owners, most of them are contacted post-op, say your pet is, recovering from anaesthetic, the procedure went well, just to give them that reassurance. What is the time frame that you then give that they can go home, and why do we not send them home immediately?
So our time frame is normally, I'd say at least about 4 hours after surgery is a good time, especially depending on what the procedure is. Mm. So I think dogs and cats are pretty hardcore in the fact that they can undergo a full hysterectomy and, be up and out the door the same day. they're pretty good. So I think it varies from dog to dog and cats as well, and it depends on the type of procedure they have. But basically, we want them to be awake, we want them to be standing, we want them to be, aware of their situation, and also for us to, notice if there's anything else that comes up. Are they really nauseous after surgery? Are they really painful? Do we need to add anything to their, medication? Are they still a bit drowsy? Some take a little bit longer to metabolize. Do we now need to put a drip up? So yeah, I'd say at least 4 hours, especially for bigger surgeries, just to make sure everyone's standing and looking well, gum color looks nice and pink, and that they are well hydrated and things like that.
And obviously there are exceptions to this, but most of them are offered water at least, if not some food, having been starved for that period of time. And it's a nice indication to check that there is a desire to eat, or they're not salivating, they're not nauseous.
Yeah, so it's nice to know that they are eating. We often tell the owners, they might not eat when they go home, and that is normal. We don't always expect everyone to eat on the first day, but most of them will show an interest in food a little bit later on.
What are you advising in terms of diet when they do go home after an anaesthetic?
So I normally advise that, unless it's like a gastrointestinal surgery or, for a specific thing, that they can continue their normal food. Obviously at a much smaller portion. So I normally say either like half to a quarter of the normal portion and then back to normal feeding the next day. But sometimes it's also nice to, offer them a chicken breast or something for dinner, just to make sure that they're, really keen on their food. And it also, makes them want to eat. If you got home and it was just the same old, you weren't feeling that well, I feel like I would also be like, no.
Want something nice.
Want something nice. So just a small something nice, and to keep them warm as well when they get home, and just make sure they have a nice comfy place too.
There are obviously some pets, be it cats that would normally go outside, and dogs that go home with a cone. Let's talk about the cone.
Oh, the cone.
What are you advising? Let's go to the whole discharge process. What is that process? What does it look like? Who does it, particularly in elective cases? And what are they generally advising the owners?
So obviously, again, it will depend on the type of surgery, but a lot of our pets will have to undergo a period of restricted exercise. So for cats, whether that means locking them in a bathroom so they can't go and wander around the neighborhood. For dogs, whether that's confinement or, as well having the cone, that will, the length of time will depend on, what procedures they've had done. Your bitch spays normally around about a week to 2 weeks of no jumping. But again, this is all specified in our discharge instructions. So that's the importance of the discharge, to say, I don't want them to exercise for this many days. You can maybe do lead walking only. They must be confined to a 4x4 little pen or something at home, no stairs, no this, no. So we're trying to give as specific instructions as possible in terms of the exercise they're allowed to do. Our nurses are fantastic. They do our discharges with the owners. If it's something a little bit more complicated, the vet may be present as well to discuss anything with the owner. Or if the owner has any additional questions, the nurse will sometimes come and ask us, or we will just be present if they need to ask us anything.
And what do you find the sort of the biggest question is from owners at that point?
How long do we need to keep the cone on for? So, and I am guilty myself. My pet had a face surgery and I did not request a buster collar. So I understand the pain of the buster collar, and I know it's always so difficult to keep these pets with these lampshades on, because it distresses them, it interferes with eating and grooming and things like that. But it's really just in the best interest of making sure that the surgery is a success. And any sort of licking or tampering with the wound can have some quite severe consequences. Other things they ask, obviously, again, we covered food, activity levels, and then obviously what to expect from the wound. So what am I looking for? Am I looking for discharge from the wound, redness, swelling? How long am I expected to monitor it? How many times a day should I be checking the wound? Should I be putting anything on it? Is there any aftercare that I need to do? Things like that.
medication
Yes.
and owner compliance. I'm setting you up here a little bit. How frequently are you having to really reiterate the importance of completing the course of whatever you're giving, whether it be anti-inflammatories or antibiotics or a combination? And how do you find, how often do you find out that it's not happening?
So I think actually I don't think I've maybe had one or two situations, but everyone's pretty compliant with the post-op care. And we do also say to them, especially with dogs that are a little bit difficult, if you are battling, bring it in for us to dose the meds and things like that. So I generally haven't had too much of a problem with this. We will also ask on admission, especially for cats, are you preferring a liquid for pain medication or a tablet? Same with the dogs. We will offer depending on the tablets as well, like different ways of administering them. So can you hide this one in food? What should you put it in? What shouldn't you put it in? Are you having to open the mouth and dose it yourself? Do you need a pill applicator? Things like that in terms to make it a little bit easier for them. But on a whole, I think people are generally pretty good at making sure they do their medication course. And it's also all written on the discharge as well.
That does help, I think.
Yes. I think you get given out this whole packet of medication and you get home and you're like, ooh. On the packets, we also try to be really specific when to start the medication. Are you starting tonight, tomorrow? Are you, finishing this course, or are you just giving it for a few days and seeing how they go? So that would be...
What are the big things that owners need to look out for post surgery? And you can give some examples, because I know dental is very different to, say, a procedure that has a sort of incision. But what are the big red flags that owners need to act on and return?
So I think one of the biggest red flags would be if the dogs haven't bounced back to their normal selves within at least the 12-hour period, or if you're noticing a decline in their demeanor. For me, that's one that I really, are they uncomfortable? Are they not settling? Are they really dull? Are you not able to, stimulate them and get them up and moving? Are they not eating? Is there any vomiting, salivation? Diarrhea is also an important one, because often our pain meds can cause a gastric upset as well, so tummy and diarrhea. And then obviously if they've got like a laceration or a surgical wound, you're wanting them to look at this at least twice a day. Make sure it's not red, make sure they're not licking it, make sure there's no discharge or swelling, things like that. And then I think this is probably a big can of worms as well, is also bandaging care. If they're going home with a bandage, make sure those bandages are dry, returning to the vet if they get wet, and just encouraging owners not to place their own bandages, because obviously sometimes these can be a bit tight. If you are placing a bandage for bleeding or just to cover it up, it's for a short period of time until you're able to get the pet to the vet, because unfortunately we've had incidences. And I think the one I see this for most is tail amputations, where the dog will go home, bandage will come off, it'll get whacked against a cupboard or something, a bandage is put on, it's too tight, it gets wet, and it comes in and it's infected, and we've got to go in again. So it's really important, if your pet does go home with a bandage, to make sure you know how long that bandage is going to be on, what bandage care you need to be doing, and what to do if it gets wet or it's not looking great. Just pop them back into us so we can see.
Any advice, particularly, this time of year we have intermittent rain and thunderstorms, any advice on how to keep bandages, particularly limb bandages, dry when pets have got to go outside?
Yeah, so you can do packets, just a shopping bag over the leg and just tie it around the top. Obviously, it's not going to stay on for very long, so you'd probably need to do some lead walking out to toilet. I think controlled exercise in terms of taking them out on the lead to toilet is good. I know a lot of pets don't do that, though. We do offer drip bags, work really well to put them on and tie them around the leg. We generally discourage, like cling wraps and duct tape and things like that, just because it makes the feet go very sweaty. So if you are putting some cling wrap around, you're putting the cling wrap on and then taking it off as soon as the pet comes inside. Any sort of plastic bag or covering like that should be okay.
And what would happen if it got wet and then owners dried it?
No.
But what happens underneath?
So it obviously doesn't dry all the layers of the bandage. So you still end up with a very wet paw inside, which then obviously gets hot and promotes bacteria. And then you're going to end up with a very infected wound under there. Bandage material can also shrink and stretch. So some of them will shrink and cause tightening around the limb, which then causes swelling, and then that affects your blood flow as well.
Not a nice thing to have to deal with.
No, bandages, I think, are the ones that carry the most, complications. I'd say if you are at all worried about a bandage, just pop them back in.
Always worth just a revisit.
Yeah.
Peace of mind. So I don't want to miss the opportunity to talk about those emergency procedures. And, a lot of the explanations you gave, starving, warning owners going through.
Yeah.
You have a very limited amount of time when it's an emergency procedure. Take me through what's different. You're on night shift. I'm going to give a case example. Something's come in and it's like profusely bleeding, or there's the bully who's eaten a corn cob,
yes.
which was your case on the weekend. So talk about the advice and how things change and what you have to inform owners of that is different to when it's an elective procedure.
Yeah, so a lot of these ones are about managing your expectations as well. So, how we're going to proceed step by step. And I feel like if I give owners, we're going to do this, then we're going to do this, and we're going to do this, then generally it's quite well received. Obviously, for going into surgery in a patient that hasn't been starved, is unstable anesthetic-wise, maybe dehydrated, like the dogs that eat foreign bodies, if they're bleeding out, we've got to knock those dogs out really quickly. So I generally will, say to owners, this is the procedure we have to do. The risks involved are aspiration, poor anesthetic risks in terms of bleeding out. We may need blood transfusions as well. It's an overload of information at this time, and I think that's what's very overwhelming. But I found going in sort of a stepwise routine of what you're going to do and why quickly sort of helps them to understand what you're doing. Oftentimes they're actually standing in the prep room with you while you're doing this. So to save time, I'm busy explaining to the owners while I'm going, just to get like it on fluids or a catheter put in, just so that I've done the initial prep and then I can explain to them where we go next and what the next step is. But shame they often don't have much time to, think about, funds, digest that the dog's going to be going through a big operation, that the prognosis might be poor or not so great, or they're going to be fine. So it is quite overwhelming.
Can be really emotive and really quite scary for owners.
Yeah.
And you made mention of one of the things, and that's a lot of these cases end up on fluid therapy. They end up, not just the catheter that you're doing a sort of elective procedure, or, assuming that there are no comorbidities, but you're putting an IV line very quickly. Let's talk about the costs of emergency procedures versus the elective, because, any surgery, and hopefully the listeners will kind of get a measure of why surgeries are, because there's a lot of big team, a lot of things to it. But let's talk about the cost of emergency surgeries and why sometimes it becomes a problem.
So I think for one of the best examples I can give to this is fight wounds in dogs. So a lot of the time they come in, it's 1 or 2 puncture wounds, and you're like, oh, that'll be, easy. And then we admit the dog. We've now picked up a murmur. We've found more bite wounds. It's actually not breathing very well. So we may have a bite over the chest, may have a bite over the abdomen. We don't know, has a tooth punctured into the chest? Have we now got air escaping? Have we got a puncture into the stomach or the abdomen, and now we've got like a hernia or an infection in the abdomen? So we don't know what we're diving into at that time of the evening. It's all happening quite quickly. We haven't had time to assess the patient in a healthy state. They're either presenting to us in shock as well. So we don't know how they're going to respond to fluid therapy. What state of shock are we in? Are we needing x-rays? What are we needing to do before that? Do we need to also consider bloods and things before? So those are the type of things. And that's generally why the estimates are quite broad in terms of admitting patients at night. This is also something that owners are a little bit caught off guard with. So you can say, best case scenario, we're going to sedate and stitch and he's going to be out of here in 2 hours. Worst case scenario is we're going to open up this puncture wound, find that it's gone through to the chest or the abdomen, and we're actually going to have to go in and explore or keep the dog in oxygen or the cat in oxygen for a couple of days while this heals. And then that's where obviously our extended period of treatment comes in.
Mm-hmm. Yeah, I mean, you make a mention of that, and some of the emergencies don't necessarily end up with a positive outcome.
No.
How do you find owners respond, particularly if you haven't had that conversation about how serious it is and why the costs are going to be greater, when it then comes to having to pay a bill when, say, their pet hasn't made it through?
Yeah, so this I really take quite hard, because obviously you've engaged with them. It's a very emotional situation, and now you're having to ask them for money when a dog hasn't, or a pet hasn't made it. But obviously, we've done all the diagnostics and the best to our ability to try and resuscitate them and, make sure we get the best outcome. But unfortunately, we don't have, x-ray goggles or a crystal ball to say, it's going to go this way, or, they may not turn the corner. Again, I think it also comes down to communication beforehand, saying that I think it's quite serious. We'll need to see how we go. We may not, be able to pull your pet through, but we're going to try our best to do that. So oftentimes in these emergency situations, I'm not giving owners a clear cut, it's going to be fine, or we're not going to make it, until I've had chance to assess the situation. So there are instances where we'll say, we're going to start, this is the estimate, I'm going to give you a phone call once I've gone in there and had a look. If it's really bad, I'm going to give you a phone call. If it's not so bad, I'm going to continue, and this is what you can expect. But again, it's very difficult to relay the bad news once you've admitted the pet and really tried, and they start to go downhill from that point. Oftentimes, which is also really tragic, is the owners don't get to be with their pets in the last moment as well. So, for that for them is also really, really traumatic as well. In those instances, sometimes I'd often say to them, stay close. So if I need to give you a call and you can come back in quickly, or just wait in the waiting room so we can see if our resuscitation works, hang around for an hour or so, half an hour, see if we can get them stable before a surgery, or if not, then they're there at least to be there with the pet when they have to make the hard decision.
Absolutely. I mean, I think you've probably heard this before, but people going, I don't know how you do your job. Euthanasia must be the hardest thing, and we generally all feel the same. Those are not as hard as the cases that you either can't help, the owners are not in a financial position, that they don't make it through, and you've invested your everything you can, and not being able to sort of pull them through. Those are the tough cases, or the ones where financially people are just not in a position.
I think that's really tough, and it's hard because you obviously want to help and do everything you can for them, and I think that's the thing that takes the toll the most on vets, is that we are put in a position where we want to help and we're given all these tools, but sometimes finances and things don't allow us to do what we always need to do.
And how often do you get the question, what would you do if it was yours?
A lot. So
I just want to remind you that Dr. Brown would give chicken when she gets home after her pet's had a procedure. So she's very soft and gentle. I think that's the difficulty. Like, if we were all asked that question,
what
we'd probably
we do?
All give different answers.
I think we would, and I think it comes down to the individual vet and things like that. I'm sometimes an eternal optimist, so I will often give owners all the options and the potential outcomes from those situations. But when I'm asked, if it was your pet, I tend to go through so quality of life wise, where are we sitting? are we going to have the same quality of life after the surgery as we had before? Are they, going to have a short hospitalization or a long hospitalization? And I tend to ask owners these questions so that they can, come to terms with, making an informed decision of putting their pet down. Ultimately, it is the owner's decision. So I can't say, you must absolutely put this down or absolutely proceed. But I can, guide them in the direction to making that decision. And then at the end say, I think if it were my pet, I'd be considering that they don't have a great quality of life and would possibly consider euthanasia.
There's been a lot of talk about gold standard. And I mean, this is something that I know our practice has had a lot of conversation around. We are in a position, we have got the facilities, and we will always strive for it. But we also understand that there are limitations, whether it be emotional or financial or just, physical. We have owners who are just not able to say do as much. And I think as long as owners understand the limitations of making those decisions or the consequences, that we're very happy to work with owners to say, we can try and save costs. We can, for example.
Yeah.
But as a result, this is what we may miss.
Exactly.
How do you find people sort of respond to having more options?
I think people generally like to have the options given to them. And I'll often say, if we're going to do absolutely everything, this is what we're going to do. And, and then I'll do the second best option and say, well, if we're on a slight budget, we can maybe exclude this, and this, and that will be this amount. And if we're on a really, really tight budget, we can try this for maybe 24 hours, see how we respond, and then, try an alternative solution. I think in terms of managing emergencies as well, it's just so important as well to consider insurance for your pets, because it takes a lot of the stress away in the moment when you're dealing with an emergency, not having to think, oh, where am I going to, come up with money for this. So, when you buy your puppies and you're thinking about things or specific breeds that may be more prone to emergencies, it's always nice to know that these pets are insured and they're then able to get gold standard treatment. And when you get to the vet at night and it's all a bit of a disaster, we can just say, go ahead and do what you need to do. And that eliminates a lot of pressure, not only for the owner, but for the vet as well. Because, for us, we want to do our best. We want to do all the diagnostics. We want to make sure we've got all the information to have the best possible outcome. But we do understand that that's not always possible.
How does the conversation change? It's one of my final parting questions to you. When I'm going to give an example, you have the dog that this is their third or fourth foreign body, or you have the blocked bladder cat that comes in for the fourth time with the blocked bladder. How does it change in terms of what you're advising when there are just, owners are reaching like financial and emotional limits?
So I think at that point, we also have to be realistic in terms of the pet's quality of life as well. I mean, returning 3 or 4 times to stay in hospital for a blocked bladder is not in their best interest. There are things like referral as well to specialists, but if that would be if there was no financial complications, because obviously they can be, especially for our block cats, there are other procedures that can be done to help with this. But I often will again refer back to the quality of life talk and, chat owners about the stress that it's taking on the pet as well as the financial implications of it. And oftentimes this is also one of the reasons why people do consider euthanizing.
It's very hard, when they've made it through, say, multiple surgeries, and the risks also increase, don't they, in terms of being able to now manage this case to a positive outcome.
Yeah.
Thank you for taking time out of what's been a crazy Monday.
Yes.
To chat to us about this. Hopefully it's been good and informative, and we are always open to any questions around any of these podcast topics. So if you have a question for Dr. Emma, you're welcome to ask me or put it in the comments below, and we'll definitely be there to advise you.
Perfect. Thank you.
Thank you.
Thank you.
Thank you so much for tuning into today's episode on the Pause and Effect podcast. If you found the discussion helpful, please like, share, and follow our podcast. Don't forget to leave us a comment or review. We love hearing from our listeners. Remember, you can listen to us on your preferred podcast platform. Welcome back to Just for Pets. You're with Dr. Cara.
Hi, Doc. It's Jackson the Jack Rossi here, and boy am I itchy.
Are you on a hypoallergenic diet?
Hyper what now?
Changing to a special diet will really help. And Just for Pets have a massive range. And flea and tick medication, special shampoo.
Ooh, how quick can you get some?
Order today and we'll deliver pronto.
I feel better already.
Justforpets.co.za. Vet approved, pet adored. Get it all to your door.